Hi, my name is Nur Azza Anissa binti Rosli. So today I will present about epilepsy. So epilepsy is a long-term disease that causes repeated seizures due to abnormal electrical signals produced by damaged brain cells. A burst of uncontrolled electrical activity within brain cells causes a seizure. Seizure can include change to your awareness, muscle control, sensation, emotion, and behavior. Epilepsy is also called a seizure disorder. Cause of the disease. Cause of the epilepsy healthy disease. First is genetics. Some types of epilepsy are more likely to run in families inherited. Second, mesial temporal sclerosis is a scar that forms in the inner part of your temporal lobe, part of your brain near your ear, that can give rise to focal seizures. Then is a head injuries. Head injuries can result from vehicular accidents, falls, or any blow to the head. Next is brain infection. Lastly is immune disorders, condition that cause your immune system to attack brain cells, also called autoimmune disease, can lead to epilepsy. Next is symptoms of epilepsy. Temporary loss of awareness of consciousness, uncontrolled muscle movement, muscle jerking, loss of muscle tone, blank stare or staring into space look, temporary confusion, slow thinking, problem with talking and understanding, change in hearing, vision, taste, smell, feelings of numbness or tingling. Problem Lastly is problems talking or understanding. Next is how to prevent the disease. First, get plenty of sleep each night. Set a regular sleep schedule and stick to it. Second is learn stress management and relaxation techniques. Then avoid drugs and alcohol. Take all of your medication as prescribed by your doctor. Avoid bright flashing light and other visual stimuli. Skip TV and computer time whenever possible. Avoid playing video games and eat a healthy diet. That's all from me. Bye.
Assalamualaikum. Welcome to diabetes. Diabetes have three types. Diabetes mellitus, diabetes insipidus, diabetes hyperthyroidism or hyperthyroidism. The diabetes mellitus is a disorder in which the body does not produce enough or respond normally to insulin, causing blood sugar glucose levels to be abnormally high. Whereas the excessive secretion of insulin causes hypoglycemia, where the blood glucose level is too low. What the sign and the symptom of diabetes? Frequent urination, feel thirsty easily, numbness in fingers or toes, weight loss, feel tired easily. How to prevent a healthy diet, regular physical activity, maintaining a body weight. Diabetes type 2, diabetes insipidus. The diabetes insipidus happen if the individual not drink enough water every day. A baby or young child who has diabetes insipidus may have these symptoms: large amount of pale urine that result in heavy, wet diapers, bedwetting, being very thirsty with a preference for drinking water and cold liquids. How to prevent a diet that is low in salt and protein to help your kidneys and less urine. Okay. Diabetes type 3, hypothyroidism or hyperthyroidism. Hypothyroidism is condition where there isn't enough steroid hormone in your bloodstream and your metabolism slows down. Common symptoms include tiredness, being sensitive to cold, weight gain, constipation, depression. Hypothyroidism Hypothyroidism happens when the thyroid gland makes too much thyroid hormone. The symptom is losing weight without trying, irregular heartbeat, also called arrhythmia, pounding of the heart, sometimes called heart palpitations. Cannot be prevented or treated through diet alone. It's often treated with prescription medication, so see your doctor immediately if you have this system. Thanks you.
What is gigantism? Gigantism is child or teenagers has high level of growth hormone. Causes of gigantism is pituitary tumor and carni complex. Other symptom of gigantism is enlarged hands and feet and vision problems. How to prevent gigantism? We can prevent it through surgery or radiotherapy. Dwarfism is a short stature from genetic or medical condition. Causes of dwarfism is growth hormone deficiency and Turner syndrome. Symptom for dwarfism is short finger and limited elbow mobility. How we can diagnose dwarfism? We can measurements, imaging technology, and genetic tests.
Assalamualaikum, my name is Muhammad Solihin. Today I will present about autism. Autism or autism spectrum disorder is a developmental disability caused by difference in the brain. People with autism spectrum disorder often have problems with social communication and interaction and restricted or repetitive behavior or interest. People with autism spectrum disorder may also have different ways of learning, moving, or paying attention. First, cause of disorder. We go with environment factor. Firstly, electromagnetic radiation toxicity. Second, heavy metal toxicity. Third, vaccination. After that, exposure to chemical pollutant. And lastly, medicine use early in life. Next, we go with patient and family related factor. First, or the age of parents. Second, nutrient deficiencies. Third, health status of mother. Next, genetic factor. And lastly, is stressful family life.
Okay, we will continue to the symptoms and ways to prevent. First, autism is a spectrum of symptoms. The seriousness of this disease can be classified into several levels, which are control level, moderate, and alarming level, and it depends on the effect of the symptom on the daily life of the patient. Okay, so what are the symptoms? First, the patient will have issues with communication, which is if we call their name, they will not respond to us. Okay, second, hysteria. Sensitive to loud noises, tiptoeing, ignoring the danger, avoiding eye contact, prefer to playing alone, and delay speech development. Okay, we will move to the ways to prevent. Actually, there's no way to prevent autism spectrum disorder, but there are treatment options. Early diagnosis and intervention is most helpful and can improve behavior, skills, and language development. Actually, there's no way to prevent autism spectrum disorder, but there are treatment options. Early diagnosis and intervention is most helpful and can improve behavior, skills, and language development. Okay, I will share to you guys two types of prevention that we can do. First, social skill training, handling teasing, being a good sport, and showing good host behavior during play dates to the patient who have autism disorder. Second, you can do early intervention too. You can family training, speech therapy, physical therapy, hearing impairment services.